Hello, I'm at the home of Miss Savoy, a home health patient that I will be doing the head to toe assessment on today. I'm going to introduce myself to Miss Savoy. Hello, Miss Savoy. My name is Sherilyn Greene. I'm a nurse practitioner that will be doing a head to toe assessment on. Is that okay with you on today?
Yes.
Okay, Miss Savoy. Just for the record, I would like to mention that I've already checked Miss Savoy's height and weight, vital signs, even checked for any level of pain. She has 0 on today out of 10. I've also checked her alertness, her level of consciousness, which is that she's awake, alert, and oriented to person, place, time, and situation. I've also checked her gait when she walked into the room, that it was steady movement and rhythmic, no staggering gait. I've also checked Mrs. Savoy's cranial nerve number 2, which is optic with the Snelling's chart, and her vision is 20/20. So now we'll go ahead on and proceed with the physical examination of you, Miss Savoy, starting with your head. I'm looking at the contour, the symmetry, the facial contours of your face, the symmetrical, your eyes are symmetrical, nose midline, your mouth, no droops, no rashes, no lesions. Then I'm going to palpate your head for any lumps, bumps, any depressions. Also palpating your face for any depressions area. I'm going to palpate your maxillary sinuses here. I'm sorry, not maxillary. Let's correct this. This is your frontal sinuses here. This is your maxillary sinuses here. No tenderness, no facial expression of pain or discomfort there. I'm also going to be looking at asking you with your facial expressions. Can you frown for me? Can you smile? Can you blow out your cheeks? Okay, that's checking cranial nerve number 7, which is your facial expressions and your facial movements. I'm also check the facial sensations. I'm going to ask you to tell me what you feel, if it's sharp or smooth or soft.
So, so,
Okay, she has been able to recognize the different uh, textures of soft and sharp. That is also checking cranial nerve number 7. Along with that, Miss Savoy, I'm gonna go ahead on and check your eyes. I will check. I would have dimmed the lights, and then I will look into your eyes, look straight ahead. I was looking for direct constriction of your pupil, and again I will shine it again. The other pupil should have constrict on the other side, and it did, and that's consensual. From there, Miss Savoy, I'm going to be also, and that's checking cranial nerve number 3, which is oculomotor. And then I'm going to check with this pin light, having you look straight at it. Don't move your head, just look straight at it. I'm going to put your eyes through 6 cardinal gaze. Just follow the pin light. Okay, that is 6 cardinal gaze. And that's again checking cranial nerve number 4, cranial nerve 3, cranial nerve 6. Cranial nerve 4 is trochlear and cranial nerve 6 is abducens. I'm just going to check conversions now on you, Miss Savoy. Just follow the pin light going straight to the bridge of your nose. That is the conversions test, and her eyes did convert. So again, another test that we're going to check just to check your peripheral vision. Just tell me when you see my fingers in your view. Look straight ahead. One more time. Okay. Peripheral vision is intact. From there, Miss Savoy, we're going to go ahead on and check a temporal pulse on you, just to make sure your temporal artery is intact and getting blood flow. From there, that is palpable. From there, I'm going to go ahead on and look at your ears. I'm looking for the symmetrical of your ears, no lesions, no discoloration. Again, I'll do the tug test on your ear for any this to elicit any discomfort there. And one other thing with your eyes, Miss Savoy, just to go back for the eyes, I will have checked inside of your eyes just to look for your optic disc and your red reflex. So I would have taken the light, have you look straight ahead and looked inside your eye for any abnormalities there or any foreign bodies. From the tub test, I would switch deal here on my otoscope. I would go into look in your ears. I would pull up and back and looking at the tympanic membrane. It should be translucent grayish in color, and also your bony prominence, and looking for any impacted wax and you have any. Uh, and Other than that, I would also do the next test, which is called the Weber test. I will strike this tuning fork, put it on top of your head, and you should hear the sound laterally in both ears. And I strike it again, and I'll put it behind your mastoid bone, and it should be, you should hear the sound until you don't hear it anymore. And when you don't hear it anymore, I put it in the same side of your ear, and you should still hear the vibration. That means that it's intact, that air conduction is greater than bone conduction, and that is a normal finding. Now we're going to go ahead on to your nose, Mr. Boy. We're going to go ahead and look at your nose. I've already have described that it's symmetrical. There is no septal, no nasal deviations or area there. So I'm just going to go ahead on and look inside your nose. Pull up on it. You have no redness, no polyps, no septal deviation in there. I'll have you do the patency test. Put your hand on one ear, do it, one nose and then the other, and it's patent. I would have you close your eyes, Miss Savoy, and I want you to sniff on this and tell me what you smell. Okay, that means her cranial nerve number 1 is intact, olfactory. And when we were testing your hearing, I was testing cranial nerve number 8, which was acoustic, and that was intact. From there, I'm looking at your lips, and they are no cracks, no ulcerations, no sores there. I would have you open up your mouth, Miss Savoy, and I'm going to look inside your mouth. I'm looking at your teeth. I'm looking at your soft palate, hard palate, your tongue, your gums, and looking on either side of your cheeks, and looking for any crustation or ulceration in the area, any bleeding gums or any kind. I would have you say ah. When you say ah, you're looking at your alluvial midline. I'm gonna have you to stick your tongue out and push side to side. That's checking cranial nerve number 12, which is hypoglossal. I'm also, when I made you say ah, that was checking cranial nerve number 9, which is glossopharyngeal, and cranial nerve number 10, which is vagus. From there, I'm going to your neck area, Miss Savoy. I can also palpate your carotids, and I would do it on both sides. From there, I'm looking at the midline of your trachea, looking for any lumps, garters of any kind, or any rashes or ulcerations. From there, I'm going to get behind you, Miss Savoy, and I'm going to be checking your trachea. Below the trachea, I'm looking at your carotids. Your thyroid glands, and I'm gonna ask you to take a swallow, and it should move up and down. I felt no lumps, no nodules there. Okay, getting back to the front of you, Miss Savoy, and then I'm gonna ask you to go ahead on and put your neck through a series of range of motion, chin to chest, extend side to side, and then ask you to shrug your shoulders. And that's telling me that cranial nerve number 11, spinal accessory, is intact. From there, Miss Savoy, I'm going to just go ahead on and check your chest area. I will be looking down in here, checking again for any discoloration, any pain or discomfort that may elicit from me pressing on you. And then I can check for pherematous, or by doing tactile pherematous, and actually to say 99.
99.
And I feel the vibrations. That means you have no consolidated areas in your lungs. From there, I'll do an auscultation. I'll be listening to your lung sounds and ask you to take a deep breath through your mouth. In a ladder fashion, again, I would do front, anterior, and posterior. And from there, I can also have you say the E sound while I still have the stethoscope on. I can have you say E,
E, E,
And if I'd have heard a sound, it could be an indication of consolidation in your lungs. But I did hear good vesicular sounds in and out, inspiration and expiratory uh, breath sounds. Going back, run more time back into your upper area right here. I want to check your lymph nodes while I'm in this particular area. I will check your preauricle, your postauricle, your tonsillary lymph nodes, your submandibular lymph nodes, your submental lymph nodes, the tonsillary lymph nodes, and your cervical lymph nodes. Checking those lymph nodes for any hardness or nodules. From there, I'm going to go ahead on and look at the posterior area of you. Can you turn, Miss Savoy, just this way? And I'm going to check your chest expansion along with percussing those areas. I can also check percussing in this area if looking for a resonant sound, avoiding the scapular area. And I'm just going to percuss. It's just a quick tap, and I should hear a resonant sound on your just like I say, avoiding that. So I'm looking at the chest expansion and asking you to take a deep breath. Okay, it rised up and normally and symmetrically and had no problems there. Okay, now Ms. Savoy, I'm going to be listening to your heart right here. I'm going to be listening to your heart's sounds. I'm looking at just listening to your heart. S1 and S2 sound. Your S1 sound means I'm telling me that your mitral and tricuspid valves are closing. Your S2 sound telling me the aortic and pulmonic valves is closing. I'm going to listen to the aortic area, which is in the second intercostal space on the right side of the sternal border. The second intercostal space on the left side of the sternal border is your pulmonic area. Your Erb's point is where the tricuspid area is, and your fifth intercostal space, mid-clavicular line, is where your mitral valve area is. And I'm checking for any bruits, any murmurs, any abnormal extra hard sounds or gallops in your lungs. In your I'm sorry, not lungs. We talking heart area. And also we'll check the maximum point of impulse right up in here, just to make sure that I don't hear any murmurs in that area as well. Furthermore, we did all of that. Now have you lie down, Miss Savoy, and we're going to check some other things on you, reference to peripheral vascular area, circulation and everything. I would check your radial pulses on both sides. I would check your popliteal pulse underneath your knee right here. I would check your dorsalis pedis pulse here and your posterior tibial pulse. I'm checking your capillary bed refills. It should be within 3 seconds, and your capillary refills in your fingers and your toes. Again, now we're going to go to the abdominal area, Mr. Boy. We're going to quickly go there and look at your abdominal area, looking for any ulcerations, any rashes, any bruising, any herniated areas. And I'm looking at the umbilicus area as well. After inspection, I will go ahead on and do an auscultating in all your quads for bowel sounds. From auscultation, then I would do palpation. I'll do a light palpation, and then I'll do a deep palpation, trying to elicit any pain. This is a rebound test to see if you have an appendicitis, and if you have pain when I release, that could be meaning appendicitis or peritonitis. I can do also on the left side, which is called a Rosen sign. I would release that real quickly, and if you had pain on the right, that could indicate a peritonitis or appendicitis. Again, I was looking for gallbladder or to elicit any problem with your gallbladder. I would do what's called a Murphy sign. I would hook up underneath your costal margin, ask you to take a deep breath. And if you stop in the middle of it and say you had some severe pain, this Murphy test would tell me it's positive that you may have a gallbladder cholecystitis or peritonitis or something going on in that area. From there, I'm looking at any pulsating waves as well going on right here with your abdominal area. Uh, Other than that, let's see, we're going to go ahead and take another test that I could do. It's called a ipsop sign. If you raise up on your thigh, and if you had pain in here, that could mean pain. I can also check right here and do an arbitrator sign and just list it right here. And if that gave some pain, that could mean also peritonitis or appendicitis going on there. I would do the strength test, pushed on my legs, on my hand, push your leg, push, try to resist. Again, I can do that with your fist here, and have you to. I'm trying to push this way, so you try to stop me from pushing. Okay, strong. Okay, come on, Miss Ford. We're gonna come on and sit up right here, and we're gonna get to the rest of your assessment. If you can back up a little bit more off the bed, I need to get to your feet here. And we're going to do a test on your reflexes. This is the neurological aspect of the test. I'm looking for right underneath your kneecap. There is a little bone there, that tendon that we will be testing. And it should have a reflex movement there. And again, there's another reflex that we can check in your upper arm. Just kind of relax your arm with mine. And that did move, and you have an active reflex. That's good, and it's intact. The next test, while I have you sitting right here, I'm going to have you close your eyes, and I will have this neurological test that I will put an object in your hand, and I would like to tell me what you feel.
A key.
Okay, that's telling me your ability to recognize objects is intact. And the next test I would like for you to test is a test that I want to call graphanosis. And I need to tell me what I wrote in your hand.
3.
And one of the tests, Miss Savard, that I can go back and just to recognize that I want you to recognize this smell. I think we want to make sure that your cranial nerve number 1 was intact. Sniff this. Mint. That means cranial nerve number 1 has been intact as well. And that's part of sensory. Okay. If we gonna stand up, Miss Savard, we're gonna go back through the musculoskeletal area. We're gonna have you stand up with your hands to your side, with your eyes closed, with no swaying. That means your cerebellum equilibrium is steady and is good. Okay, stretch your hands out to in front of you. We're gonna do the promenator drift. Close your eyes, Miss Savard, and that's intact. Okay, we're going to do some range of motion now. That's checking your musculoskeletal. We're going to do abduction. Stretch your arm out this way. Adduction. Cross you. Behind you. Okay. All right, that's some movement. Can you move from side to side? Side to side. And back. Okay, that's putting your body through a total range of motion. Can you lift up your leg one on the other? Okay, that's good. Very good. Miss Savard, let's see. We pretty much getting close to the end of this testing. Any other problems that I think I haven't mentioned yet, but I think we pretty much gotten just about all of it, but I need to at least get a couple of more tests in. Let's get your hand and make a fist here. If you had come in with any problems with your carpal tunnel area, in your pain in this wrist area, there's a test called Finkenstein, and I would have you make a fist and do this, and that will tell me that you're having some pain in here in this tendon area. That needs to be some attention. Is that it might be the carpal tunnel medial nerve that is a problem. Okay. Other than that, Miss Savard, there's also a test called the Allen test. I will have you make a fist with your hand, and what I'm going to do is move this, and I'm going to occlude both of these arteries here, radial and ulnar. And I'm going to have you open your hand. You see how it's white? I'm going to release one. and it should pink back up, and it did. So that's a test that they usually do right before they go and do a big ABGs and blood gases on you to make sure that artery is intact. Okay, have a seat, Miss Savoy. Um, Other than that, that is pretty much the test that I was going to probably do pretty much all of what I'm doing. I'm just going to make a quick survey of what I've done so far, Miss Savoy, to make sure that I haven't missed anything. Uh, I did the Allen test. I did operative rebound, all of this. I did pretty much all the tests that I can think of that, that would be important for a physical examination. So I've summarized pretty much right now everything that we've done. I've done your eyes, your ears, your nose, your throat, and your abdominal area. Like I said earlier, that you are a healthy 76-year-old, and it's proving with the physical examination that I've tested on you so far. So thank you, Ms. Savoy, for your time and your test and your patience with me on today. Any other questions or problems that I need to know about? Okay. All right. Thank you.